Hello, everybody.
Hello.
We are overdue for an update.
Yes.
Oh, where do you want to begin?
It's been busy, so that's why we've been taking a long time to respond.
It's been busy since my birthday weekend in Molokai. It was busy before that. As you know, we're in the middle of the Molokai vlogs right now.
Yeah.
But long story short, Ed's been doing okay and stable medically.
Yeah.
As you know, earlier this year, they were trying to determine whether he had predominantly necrosis or recurrence. And necrosis is basically cell damage because of the radiation therapy. And continuously, it's looked like it's been more predominantly that necrosis, but there's still areas that they're tracking. Yeah. Since the beginning of the year, you've lost your ability to read.
Yeah.
Which is weird because you can still text, you can still type, you can still even write your own handwriting, but then you can't read it. So that's one of the interesting things about two sides of the brain. But in any case, that's not of concern to the doctors because, again, Ed's medically stable.
That's because it's not them. But...
Exactly. So there's that quality of life versus, whatever else that they're looking at. So there's been areas that we've been focusing on. You had a little bit of a scare with your last MRI. There's something that is evident that has been undergoing change in the past few months. Oh, Cal's here and wants to play.
Sorry, the dogs are with us, yeah.
They are very stressed because, cutting to the chase, we're moving, as you all may know. And we had announced, if you follow us on social media, that we were moving to Connecticut.
Right, which is where I was born and raised, went to school,
All your family and our support network is there. I was starting to get everything ready for us to move to Connecticut. We made the announcements. And something that I think a lot of people don't realize is how hard it is to manage healthcare. You think just because you have doctors and you have a diagnosis and all of that, that you just move and that continues going. Nope. Case in point, when we moved here, I was battling to get your maintenance MRI. They wouldn't do it here without a referral from your primary care. We didn't have a visit with our primary care scheduled because it was still the height of COVID. Yeah. So you ended up having a seizure that got you an inpatient MRI. Moving...
Although we got something, see?
We did, we got an MRI.
I fell on the ground and did my little thing and then you got it.
Got an MRI,
there you go.
So thank you, by the way. It took some off my plate, visiting you intubated in a hospital.
Yeah.
But, right after moving to Hawaii. So moving back to the mainland, like I said, we were going to go to Connecticut. I was trying to get him in with the doctors and we started realizing Ed and his family are in Connecticut, which is where we were going to live. We were looking at hospitals in New York City. We were looking at hospitals in Boston. And all of them want all of the records first before they even talk to you. They want everything in the way of legwork done. See, Cal doesn't even like it. You hear him groaning over here. He's like, I'm tired of this story. Yeah. So I can't easily get all of Ed's records to go to one place because there's Moffitt, there's Orlando Health, there's stuff here in Hawaii. And even though everything is electronic medical records, I don't think we've had two hospitals that use the same electronic medical records, and they don't talk to each other. Mm-mm. So the legwork always falls to me. I was having a hard time getting all of that set up. And one thing that your oncologist here said is he doesn't want the ball dropped. And there's nothing, urgent right now, but since we're making the move at a good time, he wants that continuity. You've already been seeing two providers in Phoenix.
Yeah, we started that, was that after my first seizure we started?
Yes, that was right after you had the seizure. And we've always had multiple doctors looking at you because your type of brain cancer it's not uncommon in the realm of brain cancer, but brain cancer in general is uncommon. So having multiple eyes on it at all times has been of value to us. Even when you were done at Moffitt, you kept Orlando Health in Moffitt. And then moving here, we kept those two doctors in Phoenix as well. And I called them and I kind of vented the challenges I was having, and they got everything squared away for us to move there.
Yeah.
And the other thing we realized about Connecticut is, it sounds silly, but there is an issue of weather. If you have to go for infusion again, which the doctors in Phoenix want you to do Avastin again, just because it was beneficial, that's an infusion every 2 weeks. We don't know where in Connecticut that was going to be because we didn't have a doctor. We didn't know where your doctor would be. That meant we could be driving to Boston twice a week.
Which is, that's a lot of different weather.
Yeah, and it's a distance twice a week, me working. So everything was easier for us to go to Phoenix. Now, we lose, those connections that we have in the Northeast, But we gain a lot of other things that we need for us to be balanced in Phoenix. We live there. We know how to do things there. We have a primary care physician there. I've been reestablishing with all of my own doctors in Phoenix for self-care. I've been getting you established with all, well, they're your old doctors now because you've been seeing them for almost a year. So we changed our plan to go from Connecticut to Phoenix. Cal is much happier with that because he's a desert dog. He's coming, he says, oh, here he is. He says, hi, I like the desert.
He does.
So, yeah, he does. He does not like the rain, does not like the water.
Sorry.
So the update is we're moving to Phoenix. Overall, it provides us the best quality of life while Ed is doing well.
Yeah.
Minus family and dear friends.
And that really is really upsetting. We've had a lot of tears. I mean, it's very hard for me to cry for some reason.
It doesn't have emotions much anymore in that regard.
But I've been able to because every message we have with them, it's upsetting. We realize we don't have that opportunity. We were really looking forward to it, but at the same time, we had to look at it and say, first thing we need to do is keep me alive to be able to visit them.
Yep.
And that's the thing.
And that's the other half of it that we looked at is, we said, Phoenix is good for quality of life when you're doing well. Phoenix is also good if you're not doing well. We have 2 hospitals that have neuro-oncologists and neurology teams that are already treating you. And one of them is Mayo Clinic, which a lot of people are aware of. So that's one of the clinics you have there. Both of them have connected you with their surgical teams. So if you need surgery, it's there.
Yep.
Both of them and multiple other locations in Phoenix are running clinical trials on all types of cancer, brain cancer, cancer after effects. So if you go to Mayo, that's a 15-minute drive from Central Phoenix. If you go to one of the other clinics, everything is within like a 15 to half-hour drive because that is the Phoenix Metro Valley. Everything's there in the city. While there's great treatment, again, which we're not connected with yet in Connecticut, all of it can be far from Boston to New York City to Hartford. It's all over there and it's such a distance. And again, the biggest point, we're not connected with it. Yeah. So in the time that I vented to Mayo Clinic to help coordinate everything, when we were thinking Connecticut and then talking to them today with, kind of our updated plans, they scheduled Ed for everything. You have an appointment when we get to Phoenix with the doctor. You have infusion set up should you decide with him that you want to do Avastin. You have your next MRI on the calendar. You have speech therapy set up at Mayo. Everything is set up at Mayo from the minute we said we're coming back.
Yeah, and I think the biggest part of that is it just means, it's one of those things that you could cry because it's one less thing for you to figure out.
Yep.
Because I can't do a lot of stuff that I used to be able to do.
The biggest component for you to be able to do anything is you don't realize how much you rely on your reading. And when I say, Ed can't read, it's not that you've forgotten how to read or unable. Ed's brain doesn't recognize the input of characters. So you can't even help with packing things and keeping a list going. You can't call to follow up on appointments. I can't give you a phone number and you be able to dial it. I have to tell you what the phone number is. So a lot of this does fall on me, and while more people, like our friends and family, would be a big help to me, I don't know how to explain to all of them what it is we need them to do because I've just been doing it. So having a team, be it Mayo or the other clinics you're going to just step in and continue what's going on is so invaluable.
Yeah.
And again, they already have all the records. They don't need to get them all. So when you're looking at people who are trying to navigate healthcare and they're trying to make decisions, and those decisions seem kind of counterintuitive, realize that there's probably a lot more going on behind the scenes that affect those decisions than you might ever realize. Yeah. I mean, cancer doesn't come with an instruction book.
No.
Life doesn't come with an instruction book.
No.
Brain cancer, I think we've mentioned this before, brain cancer is the only cancer that at major clinics doesn't have a navigation team because there aren't enough brain cancer patients to warrant a team dedicated to them. But it's the most confusing and hardest to navigate. Go figure.
Yeah.
So with that, we are moving to Phoenix, if you haven't picked up on that already. We are looking forward to that transition. It is home to us.
Yeah.
I mean, one of the things we've had to talk about in our household is end-of-life planning. For both of us, because if something happens to me, Ed needs care too.
It's a real thing. I mean, it's a crummy, awful thing for everybody. Whether you're single, married, whatever, you probably should be thinking, oh, I have no idea what's going to happen to me one day.
You don't know what's going to happen tomorrow, let alone 10 years. And Phoenix offered us, one, a home that's familiar, access to resources that are plentiful in the city. Like we mentioned, all the clinics we have. I'm able to continue my work there. I am licensed there as well as here in Hawaii. It's kind of a sideways transition that isn't too impactful on our daily life other than having to pack up the house and move it to Phoenix.
Yeah.
So I'm not happy to be leaving Hawaii, but I am happy that we're leaving to somewhere that's familiar to us.
Yeah, because we are still going home. Mm-hmm. It's still home. You know, we're really hoping we can see everyone again soon, you know.
Yeah, I mean, it's much easier to fly from Phoenix to the Northeast than it is to fly from Hawaii.
Yep.
There's always the opportunity to meet friends and family in California, in Florida, in Las Vegas. There's a lot of destinations around this country that are much easier to get to once we're on the mainland.
Yeah.
And so long as you're clear to fly, we can still visit with them.
You're right. I'm realizing we actually, when we lived in Phoenix, we went out to meet people on both sides of the country.
That's
people.
right.
Yeah.
Oddly, the same best friends we met in San Diego that we meet in Florida.
Yeah.
So it's possible. It's easier for us. There's a lot more we can do with a car. Let me tell you, I can't drive to California from here. It would be very dangerous. And wet.
Yeah, it would be very wet.
Yes. But we will kind of leave it there that we're looking forward to this. This is what all of you helped us be ready for at the beginning of the year with all of your help and support. Yeah. So now the time has come where we were at that inflection point in making decisions about your healthcare. Again, there's nothing urgent going on now. It was just a pausing point for us to realize there's always going to be changes, and it's perhaps the time to get back to the mainland, higher technology machines for scans with you, available and ready surgical teams should that ever need to be. Just the resources that we don't have here in Hawaii that we've realized we don't have. So we'll see you from the desert.
Hey, I'm looking forward to it. I am.
I am too.
That's home.
So. I'm just stressed trying to do all the movement. So much taken off my plate in going to Phoenix. So I hate to do this at the end of an update video, but you know that sometimes our updates are far and few between depending on what's going on. So if you aren't subscribed, make sure to subscribe so you can be notified when we do have another video. And I'll take your line here. Hit the bell icon, because even if it's not something that's a health update that you're getting notified about, you can still keep tabs on us, whether we're having fun, what we're doing, and you can be a part of our life as we continue moving forward.
Yeah. A whole new place to have videos and vlogs.
That's true, and somewhere that we love, that we will show you our passion for.
It really is awesome there. So if you haven't been, it's really cool.
We'll take you so then you can get excited. So thank you to all of you who have been there and supporting us, and the comments they remind us that it's not just our friends and family that we know and love, it's all of you out there too that are cheering for us. And we do this for you as well, to never feel isolated in any of your own challenges, healthcare challenges, anything. We're here to show you that there's a network out there.
Yes. Oh, that was great. That was a good one. Yeah. Yep. Pay attention to that. That's important.
So even as you leave comments, there's other people talking about this. We're the two behind the camera here, but all of you are so supportive with one another on our Facebook posts, and that's why we keep doing this. It's not just for you to see us, but it's for all of you to connect with one another, and that's how we've actually met some of our dearest friends in the cancer community. So we love you all for that.
Yep.
And thanks for sticking by us.
Thank you, guys.